My name is Jatinder Hayre and I'm a fourth year medical student at the University of Nottingham, currently based in Nottingham. So, throughout the pandemic, especially the second phase of it, I've been on the wards, and I've also been doing a bit of research as well. So I was involved in SAGE Report 21, which investigated COVID-19 and health inequalities, and some of the findings of that were very stark and just appalling. So it'd be great to speak about that a little bit and use those experiences and some of that insight gained into this testimony. The NHS was always going to struggle. Every winter, even a particularly mild winter, the NHS is near full capacity, nearly pushing full capacity. So, we have a situation where the NHS has been chronically and mercilessly underfunded. We have a shortage of 50,000 nurses, 20,000 doctors, and we have 100,000 vacancies in the NHS. We need 9,000 more GPs to have safe working practices. We have some of the shortest consultation times in the entirety of Europe. This is a situation that has been bred out of conservative ideology, pure ideology, not evidence. Our health system, science, and the people have really been held in such deep contemptitude by this government. So when you consider all that, when you consider everything, the NHS was on its knees anyway, through consistent year upon year underfunding and underappreciation. So, when even the slightest disturbance comes along, even a bad winter flu epidemic, for example, we have a terrible situation. So when a global pandemic comes along, there is no way the NHS would come out of it seamlessly. And that's a testament of government underfunding. In this scenario, I think the government made the fatal mistake, and I do mean fatal in a very literal sense. We are passing grim milestone after grim milestone, and they've delayed a life-saving intervention. I would say it's akin to a patient on a hospital bed. You're delaying it, you're not giving that life-saving intervention, and the longer you wait, the worse the prognosis. And if the country was the patient, we've put the patient in such a situation where the prognosis can only be so poor. And I think what they've tried to balance, and the fatal mistake they've tried to make through pursuing this suppression strategy, is trying to separate lives from livelihoods. So it was this constant battle that the government portrayed, a narrative that they portrayed, where it was economy versus health. And that's never the situation. What we've seen is actually you put the entire workforce into lockdown, people are getting sick, people are dying, people are in hospital, and obviously the economy will suffer a massive contraction. That's why we've come out of this pandemic with one of the worst economic hits and one of the worst death tolls on the face of the earth. The suppression strategy has failed. It has utterly failed. On the other hand, an elimination strategy, which involved, using physical distancing measures, instituting face masks much quicker, instituting lockdown measures much quicker when the evidence first suggested so, in combination with test, track and trace under a public system, publicly funded, publicly provided, rather than this dogmatic ideology of outsourcing that the UK is currently using. If we instituted this quickly, we could have had quite a low rate of COVID. We could have, pursued that zero COVID strategy, just like New Zealand, that have come out of this with minimal death toll and minimal economic damage as well. So this whole narrative that's been portrayed in the suppression strategy, where livelihoods have to be separated from lives, it's just a farce. It's completely false. And I think we've done the wrong thing by pursuing a suppression strategy, and well, the results have manifested in our death toll and our economic contraction. In some regards, it's actually quite nice being able to have some sort of routine and having, just having the privilege of being able to go out and work. I think that's very therapeutic in itself, but there have been some very obvious challenges. So we've suffered in the way that other students have, in the fact that a lot of our education and learning has been, it's been compromised to a great extent. So clinical exposure has been gone, is down. The rate of mental health at university amongst medical students is up. We see it anecdotally at my university, and with the social distancing guidelines as well, it's very difficult to be able to provide that one-to-one support service that was once, the bread and butter of what we used to do when people were struggling. Another aspect that often doesn't get discussed is, because we're in hospital, because we're in contact with patients, because our risks are higher than the general population, and because we're away from home, we're separated from our families, and often we have long stretches of time where we can't go back. Another aspect of this is that I have friends um, that are in district hospitals. So they're away from Nottingham, they're away from their support systems, they're often isolated. And in usual times, they'd be able to come back to Nottingham, come back to their support systems, come back to their support network, come back to any mental health services that they may have been engaging with. All of a sudden, they can't do that now, and it's snatched from them. So, there is a lot of struggle going on. And the one issue that hasn't been mentioned are students that are commuting. So there's a lack of provision of any hospital accommodation. And often what's happening is students are going to hospital and often coming back to elderly parents, and sometimes parents that are having to shield. And there's absolutely no support available for them. So it is a desperate situation for some. In some ways, it is nice being able to go out and work. And it is nice to be able to, still provide some sort of care and capacity to people. But there are obvious challenges, and not everyone has come out of this in a good shape, and there's a lot of struggle at the minute. Like I said, I have a big interest in health inequalities and the social determinants of health. And one thing I was interested in what the panel had to say. It's a group of experts, and it's not often that you get the opportunity to give such a question to such a great bunch of people. So I wanted to ask, how do we mitigate the collateral damage of COVID-19 and the lockdown measures? How do we go forward and mitigate these awful inequalities in the domains of the social determinants of health? What can we do? What can the NHS do? And what can the government do? That's what I think is particularly interesting.